All right, let's jump right into it. Today, we're launching what I like to call a microscopic true crime investigation, and it's happening right inside the human body. We're going to break down some fairly complex medical science into clear, visual steps to uncover exactly how our bodies get infiltrated by a totally stealthy culprit. So grab your mental magnifying glass because this explainer is all about demystifying atherosclerosis.
I want you to really think about this for a second. What is the silent threat lurking in your arteries right now? We usually think of disease as something that announces itself, right? Like a sudden fever, a terrible cough, maybe some sharp pain. But this is a covert operation. It develops completely under the radar, no alarms, no sirens, for years, sometimes literally decades before making its presence known.
Okay, let's really dive into this. If you look at the progression from a healthy, clear artery to a completely blocked pipe, it's pretty wild. And the word atherosclerosis actually paints a perfect, if, well, slightly unappetizing picture of what's going on. Athero comes from a Greek word meaning porridge. Yeah, it refers to the soft, fatty, lipid-rich material that builds up, and sclerosis means scarring or hardening, referencing the stiff connective tissue that forms around that mushy center. So we are quite literally talking about a hardened, porridge-like blockage that's choking off our blood supply.
To make sense of all this, we're going to break this explainer down into 6 quick steps: the silent arterial threat, anatomy of the crime scene, accomplices and risk factors, the making of a plaque, clots and critical consequences, and finally, fighting back with medicine.
All right, step 1, the silent arterial threat. We actually need to clear up some medical jargon first before we can really examine the crime scene.
People mix these terms up all the time, and it's easy to see why, but they are absolutely not the same thing. Arteriosclerosis, with an R, is just the broad umbrella term for stiff, hard arteries. That can happen just from getting older, which is called senile arteriosclerosis, or from the wear and tear of high blood pressure. But atherosclerosis, with an H, which is our specific culprit today, is the targeted buildup of those fibrofatty porridge-like plaques, specifically in the inner layer of our larger arteries. It's basically the most infamous member of the arteriosclerosis family.
Okay, moving to step 2, anatomy of the crime scene. Let's look inside the vessel to see where this heist actually takes place.
Blood vessels have some seriously heavy-duty engineering. To handle the massive pulsing pressure of your heart pumping blood all day, artery walls have to be super thick, strong, and elastic. They're built with 3 main layers, or tunics. You've got the tunica externa on the outside, a thick, muscular tunica media right in the middle, and then this inner lining called the tunica intima. And you're going to want to remember that name, the intima, because that thin, delicate inner lining is exactly where the break-in happens. Which brings us to step 3, accomplices and risk factors. Who or what is aiding and abetting this threat? If we look at a standard lipid profile, it's essentially a lineup of heroes and villains. HDL cholesterol, that's our protective hero. Having HDL levels above 60 milligrams per deciliter actually has an anti-atherogenic effect, meaning it actively fights the buildup. But on the flip side, our primary accomplice is LDL cholesterol. When your LDL levels creep up past normal, it becomes the maximum risk culprit, basically supplying the raw fatty materials that formed those dangerous plaques. But hey, LDL doesn't just walk in uninvited. It needs help reaching the artery walls, and that's exactly where our lifestyle factors come into play. Hypertension, for instance, acts like a literal battering ram. It causes continuous mechanical injury to the artery wall, bumping your risk of heart disease up 5 times. Then you have smoking, which is basically chemical warfare. The carbon monoxide in smoke suffocates the arterial wall, causing hypoxia, and it knocks out our hero, HDL. Throw in diabetes, which actively causes the inner lining to dysfunction, plus physical inactivity and chronic stress, and you've got the perfect environment for a vascular crime.
All right, step 4, the making of a plaque. Let's look at the actual break-in.
So how does the breach happen? Well, the reaction to injury theory maps it out perfectly. It all starts with step 1, endothelial injury. Whether it's from the turbulent flow of high blood pressure or toxic chemicals from smoking, that delicate inner lining gets damaged. Step 2, your body tries to respond. Smooth muscle cells unnaturally multiply and thicken the wall. Step 3, the barrier is fully compromised now, allowing blood cells and our culprit, LDL, to invade that inner space, the intima. And step 4, your body desperately tries to heal the damage by attaching clotting cells, which leads to thrombosis, essentially weaving a blood clot right into this growing plaque.
And this is honestly the most tragic part of the whole heist. Once that LDL enters the artery wall, it gets oxidized by free radicals, making it highly toxic. Your immune system spots this and sends in cells called monocytes to help. They transform into macrophages and literally try to clean up the mess by eating the toxic LDL. But it's a Trojan horse. The macrophages gorge themselves on so much toxic fat that they bloat into these things called foam cells. Eventually, those foam cells just die. They burst open and spill their toxic porridge-like lipid core right back into the artery wall, making the plaque drastically worse. It completely backfires.
So what happens when this inflammatory graveyard of fat and dead cells gets too big? That's step 5, clots and critical consequences. The physical reality of this is a bit of a shock to see. When you look at a gross anatomical cross-section of a fully developed atheroma next to a high-tech OCT scan of a blocked vessel, it's intense. You've got this massive, decaying core of dead cells narrowing the actual channel where blood needs to flow. And here's the really scary part. When the fibrous cap covering that core fractures or bursts, a sudden blood clot forms over it. That can completely block the artery in just a matter of minutes.
Since this operates completely under the radar, symptoms usually only show up when you're physically or emotionally stressed, times when your body is begging for more oxygen, but those narrowed pipes just can't deliver. Think about your own body for a second. If that blockage is in your heart's arteries, it triggers angina, severe chest pain, and shortness of breath. If it's restricting flow to your brain, you might get sudden confusion or dizziness. If it's in your legs, you could get really painful cramping just from taking a normal walk. Those are the critical warning signs of severe lack of blood flow.
But hey, it's not a lost cause. Step 6, fighting back with medicine. The law enforcement, if you will. Modern science actually gives us an incredible team to halt this.
Our pharmacological arsenal essentially tackles every single accomplice we just talked about. First, lipid-lowering agents like statins. They don't just lower your LDL, they actually help stabilize the existing plaques so they're way less likely to burst. Antihypertensives like AC inhibitors and beta blockers lower your blood pressure, which totally removes that mechanical battering ram from your artery walls. Antiplatelet agents like everyday aspirin stop your blood cells from clumping together, preventing that final deadly clot. And for diabetics, glucose-lowering meds like metformin protect that delicate inner lining from sugar-induced damage. Which brings us to the most crucial point. Atherosclerosis might be a silent, incredibly stealthy heist, but as we've seen today, it's highly preventable and highly treatable. You now know the exact anatomy of the crime scene and how the accomplices operate. So, I want to leave you with this. Knowing how this silent threat builds up over time, which of your modifiable lifestyle factors, getting more active, quitting smoking, or maybe just managing your stress, will you change today to protect your arteries? Thanks for joining me for this explainer. Keep learning, and I'll see you in the next one.